Hello and a very warm welcome to Science Monitor, your weekly update on what's happening in the field of science, technology, research and innovation in and around the country. I'm Aishwarya Kapoor with you. From a new weather app to provide up-to-date information in multiple cities of India to IIT Kharagpur's portable device to diagnose COVID-19 without using the RT-PCR setup, we have plenty in store for you. So let us begin with the headlines. Indian Council of Medical Research conducts International Symposium on Novel Ideas in Science and Ethics of Vaccines against COVID-19 pandemic. Mausam app to provide city-wise weather information in 5 service areas launched by Ministry of Earth Sciences to mark its 14th Foundation Day. IIT Kharagpur develops innovative device to detect COVID-19, generates result within 1 hour without using RT-PCR and high-end infrastructure. As the first mobile call made in India complete 25 years, we interact with Professor Abhijit Karandikar to talk about the mobile revolution in India and its progress towards 5G technology. Traditionally, the development of any vaccine can take about 10 to 15 years. But the pandemic of COVID-19 is pushing the researchers and the pharmaceutical companies to develop a vaccine in the shortest possible time frame. And this calls for new ideas in science to develop a vaccine ethically. To ponder on such ideas, the Indian Council of Medical Research conducted an international symposium on novel ideas in science and ethics of vaccines against COVID-19 pandemic on 30th of July. Let us see the report to know more about this symposium.
COVID-19 vaccine candidates have reached various stages of clinical trials in many countries including India. But there are many doubts surrounding the process of rapid vaccine development. To address these doubts, an international symposium was organized on 30th July under the aegis of Indian Council of Medical Research, where some of the best minds in the field of vaccine development came together virtually and discussed the new and strategic ideas in science for developing an effective COVID-19 vaccine. The experts presented their views on ensuring the safety of the vaccine, ethics of human challenge trials, which involves affecting healthy humans with the live virus, equitable distribution of vaccine, and the potential danger of vaccine nationalism.
We need to make sure that the development and the assessment of candidate vaccines follows a rigorous path. We can accelerate maybe the bureaucracy and all that, but and the funding and what have you, but certain things we cannot take any shortcuts. First of all, we need to demonstrate that it works, and there is no way around that, and this is where the randomized controlled trial is there. And I would like to, add my support to the conclusion of the recommendation at NIH of the human challenge trials. Having gone, as we just heard, through pretty painful experience of, COVID-19, which lasted 4 months, and I'm still not fully recovered, I should say. I don't wish that to anybody. Even if we limited these challenge trials to young people, we know that the relative risk for young people to die and to have serious illness is much smaller than for a 71-year-old guy like me. But it's not zero.
I believe human challenges have a role in developing a vaccine. Why? There are several advantages of human challenges. That is, one, a quick readout on protection by each vaccine. In other words, one can test vaccines for protection against SARS-2 one by one and show which ones are protective. Secondly, and very importantly, by doing that, one can determine what are the correlates of protection. That is, what are the immune responses that give protection, and therefore which vaccines generate those responses. Then also one is able to compare vaccines head to head, which is very difficult to do otherwise.
It's quite clear that what we are seeing now is a potential danger that purchasing power, that what was called vaccine nationalism, will steer the way vaccines are distributed worldwide. Of course, we have to see to it that fairness, justice prevail when it comes to the distribution of vaccines.
The principle of distributing vaccines between populations, roughly countries, should be based on the need for that vaccine and the potential of the vaccine to improve health. Given the impending risk that a number of people have already mentioned of vaccine nationalism, whereby wealthy countries attempt to monopolize supplies for their own populations, or powerful countries of various sorts, we need to fight against that trend, and we've already heard some efforts to do so in policy and diplomatic fora. But I think whatever progress we make on that front, early and plentiful availability and manufacturing in multiple centers will reduce the leverage of what I would call bully countries, countries acting as bullies, and improve the prospects for fair distribution. Therefore, the issue of speed and timing is intertwined with the issue of equity, in my opinion.
During the symposium, India assured that the best scientific and ethical principles will be followed to develop a vaccine in the country, and the international experts exhibited their confidence in India for large-scale production of potential vaccine to meet the demand of the whole world.
India has fantastic world-class vaccine industry, has research capacity to discover vaccines. So, and I hope that you will be very active, and you've been active, but also in vaccine human trials, very important. But also, let's not forget that over half of the world's vaccines today are produced in India.
India is such a powerhouse when it comes to the development and production of vaccines. And I should also say that we at Karolinska Institute, we have several collaborative links with India that really gain in importance during this particular pandemic.
In India, 2 indigenous vaccine candidates, Bharat Biotech's Covaxin and Zydus Cadila's Zycov-D, are in the first and second phase of human clinical trials. While Pune-based Serum Institute of India, in partnership with Oxford AstraZeneca, has got 5 locations in the country to run the third phase trials of Oxford vaccine candidate, which will be called as Covishield in India. The test results of these and more vaccine candidates will also provide invaluable research data to the scientists to fight any pandemic infection in the future.
On 27th of July, on the occasion of its Foundation Day, Ministry of Earth Sciences launched a new weather app called Mausam. The day also saw the launch of a KRCnet, or Knowledge Resource Center Network for researchers interested in earth sciences. The function was held at Prithvi Bhavan in New Delhi and was attended by Union Minister Dr. Harshvardhan and Secretary of Ministry of Earth Sciences Dr. M. Rajivan, along with the other officials and scientists. Let us see the report to know more.
Accurate prediction of weather conditions not only helps sectors like agriculture, utility market and tourism, but also saves lives from impending disasters. Therefore, to provide up-to-date weather information in multiple cities of India, a new weather app called Mausam was launched on 27 July on the occasion of the 14th Foundation Day of the Ministry of Earth Sciences. The app is available on Google Play Store and Apple App Store and can be accessed in English and Hindi. This app will have forecast of next 7 days for about 450 cities of the country and weather information of the last 24 hours. Apart from this, other information including temperature, humidity level, wind speed and direction of about 200 cities will be updated 8 times a day. In addition, the meteorological department will issue warnings of bad weather and its impact at the district level from 800 stations through the app. The app has been developed by the International Crops Research Institute for Semi-Arid Tropics, ICRI SAT, Indian Institute of Tropical Meteorology, IITM, Pune, and India Meteorological Department, IMD.
If you are have installed this Mausam app, you will get a notification if these particular stations have this, that is warning, that is yellow warning, red warning and orange warning. We are giving this warning, 5 days warning also, which will be helpful for the disaster management for planning for these 5 days. And we are giving the 450 city forecast also. In the city forecast, we are giving the 7 days city forecast.
The function organized at Prithvi Bhavan in New Delhi was attended by Union Minister Dr. Harshvardhan and Secretary, Ministry of Earth Sciences, Dr. M. Rajivan, along with the other officials and scientists associated with the ministry, while adhering to the COVID-19 guidelines regarding social distancing and use of masks. The Ministry of Earth Sciences was formed in the year 2006 by the merger of India Meteorological Department, the National Centre for Medium Range Weather Forecasting, Indian Institute of Tropical Meteorology, the Earth Risk Evaluation Centre and the Ministry of Ocean Development. India is the only country which has a dedicated Ministry for Earth Sciences. The Ministry of Earth Sciences MOES also launched a Knowledge Resource Centre Network KRC Net to integrate all MOES knowledge resources and databases in this field. Set up under the Digital India flagship, the aim of KRC Net is to provide the entire knowledge resources of the ministry and its institutions to the public 24/7 on a single web portal. This will involve updating the traditional library system into a top-notch digital one, providing online access to hundreds of journals and magazines, books, videos, news and publications under quality control and ISO certified system.
We have made a portal. Through that portal, one will have access to the intellectual world of Ministry of Earth Sciences. So through that portal, you will be able to access what are the documents are coming up from the funded research, which ministry funds.
The Ministry of Earth Sciences has many significant achievements since its inception. Currently, India is offering the world's best weather services for disaster management with accurate warning of tropical cyclones, heat waves and floods. In addition, the country's meteorological department also provides information and advice to the 13-member countries associated with its ESCAP panel. India has also developed for the first time an Earth system model for future climate projections and is going to start the first phase of instrumentation to set up the atmospheric research test beds in 2021, the unique facility in tropics.
And now it is time for a short break. Stay with us, we'll be back with more reports. Welcome back after the break. You're watching Science Monitor. Scientists and researchers of the country are constantly working to develop new solutions for the diagnosis of COVID-19. In this series, researchers of Indian Institute of Technology Kharagpur have developed a new portable device for rapid diagnosis of COVID-19 infection. With the new device, the test results become available within 1 hour in a customized smartphone application. Let us see the report to know more about this novel technology.
To monitor the progression of COVID-19 at different locations in the country, there is an emergent need to run large numbers of affordable and reliable diagnostic tests with minimal infrastructural support. And to fulfill this need, researchers from Indian Institute of Technology, Kharagpur, have developed a new device for rapid diagnosis of COVID-19, which does not need RT-PCR machine or laboratory infrastructure. The Institute's School of Bioscience and Department of Mechanical Engineering have collaborated to develop this first-of-its-kind device to diagnose the viral infection.
This is very much different from the traditional detection systems being used worldwide. This method has eliminated completely the need of a PCR machine. This device we have designed to be usable at locations where resources are extremely limited, environment is absolutely uncontrolled, so that the needs of the underserved community can be catered.
In this particular protocol, we have added 3 different checkpoints. In the first step, we are using specific probes, we call it primers, which can specifically detect the viral RNA and then convert it into millions of copies of DNA. Subsequently, in the second step, those DNA molecules gets detected specifically by the second probe. So that's our second checkpoint. And finally, when we are applying these reaction mixture on the paper cartridge that we have developed, there we have added the third probe, which can detect the probe that we have used in the second step. So as you can see, these 3 probes acts as a specific checkpoints which ensures high precision and accuracy of the test result.
More and more such devices should be made, commercial devices should be made, some of the commercial houses should be approached, and if they can take on a large scale basis, I think this will be a great, you can say that, a great service to the mankind.
Sujay Kumar Vishwas, a PhD student at the institute, has designed and fabricated the device under the guidance of Professor Suman Chakraborty and Dr. Arindam Mondal. Since this innovation has reduced the need for complex setups and expensive machines, rapid testing can be done at a total cost of ₹400. And interestingly, while the RT-PCR machine costs around 15 lakhs, this device costs just 2,000 rupees. The device has been validated for the diagnostics of COVID-19, but it can also detect any other kind of RNA virus by following the same generic procedure.
To mitigate the COVID-19 outbreak in the country, Council of Scientific and Industrial Research has developed various technologies in the past few months related to the surveillance, diagnostics, drugs, hospital assistive devices and supply chain. On 30th of July, a compendium of these technologies was launched by the Union Minister of Science and Technology at a function organized at CSIR headquarters in New Delhi. Let's have a look at the report.
The Council of Scientific and Industrial Research under the Ministry of Science and Technology is the largest R&D organization in the country and has a pan-India presence with its network of 38 laboratories. During the last 6 months of the COVID-19 outbreak, CSIR laboratories have developed significant technologies in the field of diagnostics, genome sequencing, and repurposing of drugs, along with devising many other solutions to minimize the impact of COVID-19 in the country. On 30th July, Union Minister Dr. Harshvardhan launched a compendium on these mitigation technologies developed by the organization at the CSIR's headquarters in New Delhi. The function was duly attended by many senior office holders, including the Director General of CSIR, Shekhar C. Mande.
और आज मुझे खुशी है कि लगभग 100 से ज़्यादा टेक्नोलॉजीज़ जो पिछले 3 महीने के अंदर और विविध क्षेत्र जो कोविड के खिलाफ जंग के लिए इम्पोर्टेंट हैं, उनके बारे में उनको साइंटिस्ट ने टेक्नोलॉजीज़ को विकसित कर लिया। विकसित करने के बाद 93 इंडस्ट्रीज़ के माध्यम से उनको लोगों तक पहुंचाने का काम कर लिया।
Considering the multifarious problems created by the novel coronavirus, CSIR has set up 5 technology verticals for addressing the emerging situation due to the pandemic. These verticals include surveillance, diagnostics, drugs, hospital assistive devices, and supply chain. To accomplish its goals, CSIR is working in close synergy with other government departments, ministries and agencies, and also with industry, MSMEs and others for scale-up, delivery and implementation.
Time for another short break. Don't go anywhere. We'll be right back. Welcome back. You're watching Science Monitor. Do you know when was the first mobile call made in India? Well, that historic day was 31st of July 1995. Within 25 years of this historic development, India has seen unprecedented progress in this sector, and today we are at the threshold of adopting 5G technology. To celebrate this journey and to know how India is progressing towards 5G technology, today we are joined in by Professor Abhijit Karandikar, who is renowned for his work in the telecommunications sector and is also working on frugal 5G to accommodate the needs of rural India. Currently, he serves as the director of IIT Kharagpur. Sir, thanks so much for joining us. 31st of July 2020 marks 25 years of the first mobile call made in India. How do you see this journey?
Last 25 years, we have seen a phenomenal growth in cellular mobile communications. Today, our overall tele-density is more than 80. We have more than billion cell phone subscriptions. In fact, just 25 years back, the number of telecom subscribers were under 15 million. And of course, they were all wired telephone subscribers. And many of the people in the country did not have access to phones. It used to take more than a year sometimes to get the landline connections. And with the advent of the cellular mobile communications, now almost every Indian home at least has a phone, and cellular mobile communication has become the primary voice communication device for almost each Indian. So there has been a significant growth. India has become the second largest telecom market in the world.
Also, sir, what is the state of this technology in the rural sector?
Though I just now said that the overall tele-density in the country has become significant, the rural tele-density is still low, and the broadband penetration in the rural area is also requires a significant push. So these two things, the rural telephone connectivity and the broadband penetration, are going to be the most important areas where we need to focus on in the next 5 years or so in order to enable the entire country's population digitally empowered.
And sir, we are now heading towards 5G technology. So how will it differ from 4G, and what more can we expect from it?
2G brought mobile voice revolutions. 3G added some internet data. 4G brought the broadband communications. The 5G is actually is going to make all pervasive digital world. It is not only going to give a very high throughput broadband connectivity, but at the same time is going to enable massive machine type communications, Internet of Things, and applications like AR and VR, which requires very low latency.
Your interests also include frugal 5G. So what is being done, and what according to you is required to enable the broadband technologies in the rural areas?
The requirements of India are a bit different from the requirements in the Western world. Like for example, we don't need that high speed mobility. Mobility is required, but very high speed mobility is not needed. At the same time, we need very high throughput when we are nomadic, or when we are sitting at one location, because cellular mobile communication has become the primary device even for broadband connectivity. Post-COVID, we have also seen now the use of online access has become even more important, whether it is for the e-government services or whether even for educations, like for even school educations has now become online. And therefore it is extremely important that in a scenario where a large populace is working from home, it is accessing the e-government services, a large population of students is also accessing the schools and colleges online, we have everyone digitally empowered, and this becomes even true in our tier 2, tier 3 cities and the rural areas. We need energy efficient solutions because at many places in the country we may not have access to 24/7 uninterrupted electricity supply. So we actually need energy efficient solutions.
Sir, thank you so much for the insightful information, and we hope that India will scale new heights with the advent of 5G technology in the near future. So viewers, that is all we have for you in today's edition of Science Monitor. You can send your feedback and suggestions through email. Our email ID is news@vigyanprasar.gov.in. You can also write into us at Vigyan Prasar, 5th floor, Prithvi Bhavan, Lodhi Road, New Delhi, 110003. So we'll meet you again in the next episode. Till then, stay home, stay safe, and think scientifically. Bye for now.